Last Monday at 6 a.m., my phone buzzed with an emergency call that still haunts me. Another senior found unconscious, another stroke that happened without warning, and this time the cause was sitting innocently in a weekly pill organizer on the kitchen counter. I'm Dr. Bill Harrison, neurologist and stroke specialist. If you're over 60 and take daily supplements, this video could save your life. While vitamins promise bone health, heart protection, and brain vitality, 5 common ones when taken in the wrong dose, at the wrong time, or combined with your medications can quietly spike your stroke risk overnight. What you're about to learn has helped hundreds of my patients transform their supplement routines from dangerous gambles into true health protection. If you or someone you love takes vitamin D, E, B6A, or Niacin, hit subscribe to Inspired Living and stay with me. Today, we'll uncover exactly how these 5 trusted vitamins become silent stroke triggers during the most vulnerable hours of your day. But first, let me tell you about the patient whose near-death experience opened my eyes to this hidden danger lurking in medicine cabinets across America. Thomas shuffled into my office 6 weeks after his stroke, confused and frightened. He's 73, retired accountant, volunteers at the local food bank, never missed a doctor's appointment in his life. His daughter found him at sunrise, collapsed beside his bed, unable to form words, his right side completely paralyzed. What made Thomas's case so puzzling wasn't the stroke itself, but everything that should have prevented it. His blood pressure was perfectly controlled, cholesterol levels ideal, heart rhythm steady. Yet when I examined his daily routine, he revealed something that made everything suddenly clear. For 2 years, he'd been taking 12,000 IU of vitamin D every evening because an online article said high doses would protect his bones. His family doctor had mentioned vitamin D was beneficial. True enough, but nobody warned Thomas about timing or dosage. Nobody explained that for seniors, those massive vitamin doses were slowly turning his blood vessels into calcified pipelines that couldn't flex when his brain needed them most. When we adjusted just Thomas's supplement timing and dosage, his 6-month recovery exceeded every expectation. His speech returned completely. His mobility improved dramatically. His daughter said it was like watching a miracle happen in slow motion. But before I reveal exactly what we discovered about vitamin D, you need to understand why the overnight hours are your brain's most dangerous battlefield when it comes to supplements. Here's what most seniors never learn about stroke timing and vitamins. Recent research from the American Heart Association shows that strokes surge between midnight and 6 a.m. when blood pressure and circulation fluctuate most wildly. As we age, our kidney and liver clearance slow dramatically, and vitamins can accumulate or interact dangerously during these vulnerable overnight hours. Your supplement bottle doesn't come with a warning about overnight vulnerability. That's my job. The 5 vitamins I'm about to reveal don't just affect how you feel tomorrow. They fundamentally alter your blood chemistry during the precise hours when your brain is fighting for survival. Let's start with the vitamin that nearly killed Thomas. Vitamin number 1, vitamin D. Thomas took 12,000 IU every evening, convinced it would strengthen his bones. Instead, he collapsed with a stroke. I was floored when I saw his labs, severe vascular calcification throughout his brain. Why? High-dose D spikes your blood calcium. Aging kidneys can't clear the excess, so it deposits in your arteries, turning them into rigid pipes. When those overnight pressure swings I mentioned hit, clots form easily. Margaret, 78, had the same issue after 3 years of 15,000 IU nightly. Brain imaging showed extensive arterial damage that had built up silently. Test your 25-hydroxy vitamin D blood level first. Limit to 1,000 to 2,000 IU with breakfast, never at bedtime. Vitamin number 2, vitamin E. Sandra, 81, was on warfarin for an artificial heart valve. She added 800 IU of natural vitamin E nightly, worried about aging. 3 weeks later, brain hemorrhage. The deadly truth? Vitamin E above 400 IU acts as a blood thinner. Combined with prescribed anticoagulants, it's a bleeding disaster waiting to happen. Sandra's blood became so thin that normal overnight pressure changes ruptured her brain vessels. Keep E under 15 milligrams daily, about 22 IU morning meals only, and always check with your cardiologist first. Vitamin number 3, B6. James, 74, started taking 200 milligrams of B6 daily for nerve support. Within months, progressive tingling, balance problems, falls from nowhere. Here's what shocked me about his case. Excess B6 causes irreversible nerve damage, stripping away protective myelin. Those symptoms aren't improvement, they're permanent neurological destruction affecting balance and coordination. Limit B6 to 2 to 10 milligrams total per day. High-dose B-complex formulas. Stop immediately and see your neurologist. Wait until you hear about the final 2 vitamins. One mimics stroke symptoms perfectly, the other creates dangerous blood pressure swings that can kill. Vitamin number 4, vitamin A. Beverly, 77, took 10,000 IU nightly for skin and vision. She developed severe headaches, blurred vision, slurred speech, classic stroke symptoms. But here's what floored me. Her brain scans looked normal initially. Specialized testing revealed dangerously high skull pressure from vitamin A toxicity. Fat-soluble A accumulates relentlessly, compressing brain tissue and mimicking stroke perfectly. Keep A under 2,500 to 3,000 international units daily. Never stack it with multivitamins and only under medical supervision. Vitamin number 5, niacin. Carl, 80, started taking 2,000 milligrams daily for cholesterol. Within weeks, violent hot flashes, pounding headaches, then a mini-stroke during morning coffee. I couldn't believe what I was seeing. High-dose niacin creates a vascular roller coaster, massive blood vessel dilation, then severe rebound constriction. These pressure swings create shear forces that rupture small brain vessels. Limit niacin to 50 milligrams daily unless prescribed. Higher doses for cholesterol need strict medical monitoring, never close to bedtime. Now, here's your complete brain-safe supplement protocol. This is exactly what Thomas follows and what has protected hundreds of my patients from vitamin-induced vascular disasters. Morning timing only. Take any essential vitamins with breakfast when your body can process them safely and your blood pressure is most stable. Never take fat-soluble vitamins before bedtime. Dose verification. Compare every supplement dose against recommended upper limits specifically for adults over 60. Your aging body cannot handle the same doses that worked at 40. Regular lab monitoring. Get blood levels checked every 6 to 12 months for vitamin D, A, and B12. What you can't measure can kill you. Medication review. Always discuss every supplement with the doctor managing your blood pressure, anticoagulant, or cholesterol medications. Interactions can be lethal. Symptom tracking. Log any headaches, dizziness, flushing, or palpitations with exact date, time, and what supplements you took. Patterns reveal toxicity before permanent damage occurs. If you're still watching and found these insights valuable, comment "watching" below, so I know you're committed to supplement safety. Now, do this critical self-assessment. Count how many warning signs you experience, then type the letter of the vitamin you're most concerned about, D, E, B, 6, A, or N, in the comments. Number 1, morning confusion or weakness that clears after an hour. Number 2, headaches or facial flushing after your evening supplements. Number 3, numbness or tingling in hands or feet. Number 4, unexplained bruising while on blood thinners. Number 5, blurred vision or increased headaches since starting new vitamins. If you scored 2 or more, your supplement routine may be putting you at serious risk, but now you have the knowledge to fix it completely. Remember Thomas, who nearly died from his evening vitamin D megadoses? 8 months after implementing this brain-safe supplement protocol, he told me something that still gives me hope. He said, "Doctor, I finally understand that more isn't better, timing matters more than dose, and my supplements now protect me instead of threatening me." That's the life-saving power of understanding how vitamins affect aging bodies differently. After 60, your kidneys, liver, and blood vessels process everything more slowly and less efficiently. What seemed beneficial at younger ages can become toxic overnight, literally. You don't need expensive specialized formulas or complex supplement regimens. You need appropriate doses, smart timing, and medical guidance from professionals who understand aging physiology. Thomas still takes his vitamins, but now he does it intelligently. He tells me, "I didn't have to give up supplements entirely. I just had to give up the dangerous habits that were slowly killing me." Pick one vitamin habit you'll change starting today. Comment that specific change below and tag someone over 60 who needs this information. Your one smart decision could literally save 2 lives. This information is for educational purposes only and is not intended to replace professional medical advice. Always consult with your healthcare provider before changing supplements or medications, especially if you're taking blood thinners or blood pressure medications. Remember this truth that could save your brain. Right dose plus right time equals real protection. Next week, I'll share the 3 natural foods that protect your brain better than any pill. Hit subscribe so you don't miss it.